Hello, staff from ABC Medical Center. This is your CEO, Celeste Sheely, and I'm coming to you today to update you with some information that we really are looking forward, as this is going to truly help our practice become a better organized facility. What is that, you say? Well, we will be converting from paper charts to electronic health records. This is going to take us some time to make this conversion, as it is going to take us individuals from each department working together to comprise a um, a record that is going to work and be more efficiently according to the needs of each and every department. So we are anticipating this change to take place next year, approximately July. Um, each and every one of you will have to attend some training courses. We look for those to take place somewhere between June and July of next year. As you all know, that there are things that unfortunately come up and that we may have to move those dates, but something that you get to look forward to. So how is this going to benefit, and how is this going to make us a better organized facility? So let's take a look at those benefits. First and foremost, right now, paper charts. Oh goodness, we can actually start with patients who have multiple volumes. So here we are, our medical record staff is looking for the most current volume and you can't find it. Well, electronic health record is going to totally alleviate that. You will be able to have all of that information at your fingertips. So let me also show you something that I have. How many times nursing staff or any other healthcare providers, you're looking for an order, and you finally find the order, but guess what? You can't read it. So here's an example of that. No longer will you have to worry about this problem. So when you have an order, let me show you, this is what it's going to look like. It's very streamlined. There should not be any question as to what it is in regards to, I should say, handwriting, but however, there may be times that, we're going to have to be very careful there that we actually choose the right order. So that is something that we're still going to have to pay attention to. Going from a paper chart to an electronic chart is going to basically change us tremendously. It's going to make our practice better. We should be more time efficient. No more looking for those paper charts. What else does an EHR do for you? Well, medications. You will be able to look at what the patients have as far as their over-the-counter drugs that can be input into the system. What we prescribe to them, that will be in their chart. If there's any changes made, that chart will be updated. So a better organized system altogether. So now let's say that the provider has actually typed their note, or if it's going to be instead of like written down, their findings, a history and physical. So rather than having that written, you will actually have another typed out report. Definitely something that will be beneficial to not only the patient, but also to referring physicians. Sometimes they have problems reading our providers' handwriting as well. So let's take and switch to our referring physicians. How is it going to benefit them? Not only having this papered history and physical, they're going to be able to have access to the patient's chart in whole. If they need to look at lab work, look at radiology results, they'll be able to look through an electronic chart versus, guess what? Our practice is closed. Sorry, I can't get that for you until I actually go back to the office tomorrow because I don't know what the results were. That will be a thing of the past. Whenever the office is closed and whoever's on call, the physicians will be able to look up that information and share with any outside referring physician. So that is huge when it comes to patient care. Um, so let's talk about patient portals, um, and also being able to log in. Patients wondering, what did my test show? I'm going to another physician. Maybe I need to let them see what my lab results were. So that is an opportunity that they will be able to um, log in through my chart and have that access so that they can provide for other physicians. Let's talk about telehealth. Um, how in the world and what is it and how can it help our patients? So, anyone that maybe is in a rural area and they don't have access to truly healthcare providers, we can set up the system so that just kind of like I'm talking to you today, we can access patients remotely and potentially give them treatment, prescribe medicines through e-prescribe, so where that prescription could be picked up and we can diagnose and treat patients via like a webcam. So that is going to be something that we will be able to assist those patients that don't have the ability to come to a healthcare facility such as ours. So look forward to sharing that. What else can we provide? Social media is huge. So things such as smoking cessations. We can even provide our communities with up and coming events that we'll have. Let's say we want to promote a healthy heart. Anything such as that, we will be able to electronically send that information out and try to reach the community and provide better care to those individuals, and that's huge in itself. So one other thing that I would like to promote is also something called mHealth. mHealth allows folks to download on their iPhones certain apps that will help them become a better person. Weight loss apps. There again, there's other things that we can do. Let's say elderly patients that have trouble remembering, did I take my medicine? Is it time for me to take my medicine? We can set things up so that reminders will actually come across the phones that say, hey, it's time for you to take your medicine. So that is huge. So we are really, really looking forward to implementing this process for our practice. It's going to be great for each and every one of our staff members. It's going to be something that our patients and community can benefit from. And like I said, it's going to be a lot of work in the forefront. And then, of course, as we grow, we'll be able to find where we can indeed have the system grow with us. So I appreciate you tuning in today to me and listening to what I have to say. It's been a pleasure to be able to announce this to you, and I hope that each and every one of you have a great weekend, and we look forward to building this program so that we can better our community.